Let me say that Marianine Lewin, as the director of the fellowship, she reminded us that we do know something from our experience, that we bring something of value. She gave us a strong sense of guts.
As a fellow, I feel like I brought real world experiences. I'm a family nurse practitioner. I love community and community engagement. So having that opportunity to be close to those who are experiencing the problems that Congress works on every single day was definitely something that I felt like I could bring to the office.
I was a neighborhood doc. I took care of my kid's first grade teacher. I think I brought that sensibility and experience to people who had been primarily involved in policy. And so I was able, on some level, to help translate what this rulemaking might be, what this correspondence might be saying to constituents, how this would impact our primary care workforce, what physicians might need to be able to implement.
I had this medical technology background. I went into the interview. It was the senator. And the first thing he said to me is, "Will you teach me about medical technology?" I was sold. I had been teaching lots of kids about medical technology, and I was happy to think that that was something I could contribute in some way.
I discovered that the people who are making policy, most of whom are economists or political science majors, don't actually know how healthcare works. And it's really helpful to them to have a doctor in the room. I knew enough about medicine to be able to say, no, this is how it works. And so when you're building your systems, you should respect that. You should not try to disrupt that part of it.
I was 50-something and the only physician in the room. And so I was often turned to sort of reality check what the ideas were we were kicking around. Sometimes the answer was yes, sometimes that'll never work.
One of the first hearings I got to go to was with the secretary from HHS, and it was about Medicare reimbursement and the whole package. During the hearing, Senator Cassidy turned around to me and said, "How many babies are born each year that are covered by Medicaid?" And I know that data point just because of the space I've always worked in. So it was like, oh my gosh, I really know something and can contribute here.
They needed data expertise. They were tackling drug prices. There's a lot of work on Medicare and looking at what we could cover, what we couldn't cover under Medicare fee-for-service, traditional Medicare. I was coming from the all-payer claims database in the state of Colorado, so I knew the ins and outs of claims. I knew the ins and outs of that process, as well as how to do these larger analytic pieces. And so for them, it was a very natural match as well.
My background is both as a pediatrician, but also as a public health official at a local level, at a city level, administering government, federally funded government programs. So being on the ground with a Women, Infant, and Children program that directly serves women coming in for breastfeeding support, for nutrition vouchers, there's on-the-ground experience that the young people who are usually staffing these policy offices do not have. And so I really felt good about being able to bring that information and experience, because it really helps folks understand who we're serving, who we're trying to serve, and what the impact is of these policy